Okay, good morning, good afternoon, everyone. I welcome to all the participants that have joined us here today for a Comstech webinar. Briefly introducing the webinar and the speaker. Today's webinar is going to be on justifying One Health, a developing country experience. And for this, we are very honored to have Professor Zoonotic Diseases with us today to deliver this brilliant presentation. She's a professor of aquatic epidemiology and toxicology and was the pioneer deputy vice chancellor of research, innovation, and strategic partnerships at the University of Ibadan, Nigeria. She is also a Comstech distinguished scholar. As a researcher, she has pioneered scholarship and leadership in One Health, and her findings from studies on environmental pollution, food safety, antimicrobial resistance, and emerging and re-emerging infectious diseases has provided credible transdisciplinary research-backed evidence on the complex linkage between environment, animal, and human health, with significant policy implications for Nigeria, the African continent, and the rest of the world. She is also the elected fellow of various academies of sciences, including Nigerian Academy of Science, African Academy of Sciences, and the World Academy of Sciences. So we are very honored here today to have Professor Zoonotic to give us this lecture. We will start the lecture now, and then the rest of the participants can continue to join us. I'll let Professor know that this lecture will be recorded, and then we will also upload it on our YouTube Comstech channel. So anyone who needs to access this can do that afterwards. So I give the floor to you, Professor, to start your webinar. Thank you.
Hello, we cannot hear you. I hope you can hear me.
Yes, you are audible. Can you check if type?
Okay, it was at my hand. Sorry, I can hear you. I can hear you now.
Is it working now?
Yeah, it is working now.
I think there was some issue with the.
I think I muted myself. The system.
No problem. So I have just briefly introduced you and your profile to our participants.
Okay.
So we welcome you. We are very honored to have you here today to deliver this webinar. So over to you, Professor Zoonotic.
Okay, let me grapple with my. Okay, good afternoon, good morning, good evening, wherever you are joining us from. I'm actually highly honored to be invited to deliver this lecture. As a Comstech distinguished professor, this is my first assignment, and I look forward to feedback and collaborations. Today, I'll be talking on justifying One Health, a developing country experience. And I'm happy with Asif that like they didn't go through my profile. So I think that was shared before now. But my background is in veterinary medicine. And since then, with research, I've migrated into what we all now know as One Health. So this is the outline of my lecture. I'll be talking about the One Health concept. I'll be defining some things for people that are not necessarily in this background so that they'll be on the same page. The other thing I'll be talking about, I'll start from where I started from, environmental health. Then I'll be talking about how is environmental health linked to animal health, how is environmental health linked to wildlife health, and environmental health and human health. And then I'll be talking about the global public health, and then justifying One Health. And I'll be concluding and looking forward to a very interactive discussion with you all. One Health is an innovative approach to practice and research. Most of the time when you think about One Health, most of the time we think about it as a veterinary parlance domain. It's very funny because we have a need, all have a need to give names. So I think human medics will call it global public health, And people in environment will call it planetary health, and while veterinarian will call it One Health. But at the end of the day, it just shows that that the health of human, domestic animals, wildlife, and the environment is inextricably linked. That means you can't separate one from the other. This suggests that there is a need to break down barriers between specialties and sectors. And we need to identify and effectively find sustainable solutions to the many serious challenges that is confronting humanity. Starting from environmental, according to WHO, environmental health addresses all the physical, chemical, and biological factors external to a person or animal that can potentially affect their health. That means you don't necessarily have control over the air you breathe. You can have some level of control over the water you drink, but exposure here and things that you interact with the environment, you don't have control over. So it's targeted towards preventing disease and creating a health supportive environment for whether it's animal or human. Then me coming from the balance of veterinary medicine, when you talk about veterinary public health, we talk about it in terms of the sum of all contributions to the physical, mental, and social well-being of humans through an understanding and application of veterinary science. That's what veterinary public health means. And with research, disease of animals, zoonotic diseases are diseases that we know that is transmissible to man from animal and vice versa. And it's been established that 60% of human pathogens, that means disease-causing pathogens in human, are zoonotic. And then 75% of emerging diseases are zoonotic, either from animal sources. And then 80% of agents that can be used as a potential bioterrorist agents are zoonotic pathogens. So that gives us cause for worry, because now we are talking about things that are there that we don't have control over. Then another thing that is common in this balance is what we call transboundary diseases. And this talks about any disease which can spread at regional or global level. And we don't need any definition for that. Most of us have gone through COVID, before then SARS, before then Ebola. And in recent times, it seems to be happening more frequently. So highly contagious or transmissible with a potential for very rapid spread, irrespective of national borders, causing serious socioeconomic and possibly public health consequences. I think with COVID, before one used to be able to struggle to explain this, but with COVID, it's easier that a disease can have such a huge impact, a socioeconomic impact, apart from the impact on the health, public health consequences. COVID explains it all. And then we talk about emerging diseases. When you talk about emerging diseases, you are talking about a new infection that is resulting from evolution or change of an existing pathogenic agent. That means, like, maybe you've never had it before, like COVID, you've never seen COVID before. If you begin to see maybe SARS that is known in some region, but it's not known in Nigeria, we see it here, then it's an emerging disease. Then a known infection spread to a new geographic area of population, that's what it means, or previously unrecognized pathogenic agents, or disease diagnosed for the first time with a significant impact on public health. Those are emerging diseases. And then we talk about re-emerging. For example, now polio is sort of resurfacing in the US. So that is an example of a disease that has been previously eradicated in a geographic region, but is resurfacing. So that is called re-emerging diseases. And all those things are supposed to adequately position us in a way for us to understand the One Health concept. The Association of Veterinary Medical Association, FAO, OIE, WHO, UNICEF, and World Bank, in their strategic framework on One Health, which was established in 2008, define One Health as the collaborative effort of multiple disciplines, working locally, nationally, and globally to attain optimal health for human, animal, and the environment. However, I think at the inception, so many people considered the environment was just a far reach. Okay, we can understand animal and human, but what has the environment got to do with it? And that is one of the things I'll be justifying today. I put this as known to unknown. Most of the time when you talk about developing countries, most of the time we talk about the fact that, okay, we lack structure, we are not so well organized, blah, 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 so those kind of things. So I'm starting from places where they, in quotes, have structure. And so I was on an Eisenhower fellow, and what that meant was that I was supposed to go through what we call the Common Interest Program in 2007. And the theme of the fellowship was challenges of urbanization. That was what the theme was. And so what that means, I went to the US for like 3 months, and 2 3 months, and then it took me through to look at urban challenges in the US. It took me through federal, states, county, public-private partnerships, non-governmental organizations, and academia involved in waste management, because that was what I wrote my proposal on at that time, to look at how do they manage waste in the US. And I went to 12 cities on an individual basis, and as a group, 12 cities altogether. And I had meetings, I saw how the US was set up, and this was my finding. So when you talk about environmental health regulation in the US, the CDC is the National Center for Environmental Health. The CDC's National Center for Environmental Health safeguards the health of population. And then you have the National Institute of Environmental Sciences. These are supposed to be more of research-based that discover how the environment affects people in order to promote healthier lives. And then you have US EPA. They're supposed to protect the human health and the environment. And then you have the US Geological Survey. They provide information about do surveys and all that. And then you have US Fish and Wildlife Survey to work with order to conserve. And as you can see, there are so many organizations trying to do so many cross-cutting things. And from where I come from, we always joke about the fact that when everything, if it's everybody's job, then it's no man's job. Because when you have so many people that are doing the same thing, you sort of drop the ball, because everybody thinks A has done it and everybody thinks B should be doing it. Of course, these organizations have clear-cut mandates, but at the same time, you have that at times you have duplication, and at times some things fall through the cracks. And that was what I saw. So what I saw was that compliance monitoring was carried back by industry. One of the first things I saw that I thought was suboptimal was that you set up an organization. If I want to go, if I have an industry, I'm the one that will monitor myself and I keep a record. And then the government agencies will come in and then look through your record and say, you are doing well. So for me, it was very funny, because when you ask people to self-police, that is not easy. And then when the government agencies are coming, they have to give them a notice. So it's easy for me to clean up my heart before you come in. So that for me was ridiculous. And then the other thing within the US was that states had varying regulations. And this becomes an issue when resources are shared. When you talk about transboundary issues, you also have transboundary water. And it's the case of California and Nevada. You know, if you set your industry in Nevada, the tax is lower, unlike if it's going in California, and they share the same water, they pollute the same water. So it's really, you have all those kind of narrative that's very funny. So in Illinois, where agricultural farming is extensive, where most of the concentrated feeding animal operations are located, pesticide, hormones, and pharmaceutical products are of great concern. But as we go on, you find out that we live in an imaginary boundaries, though you have states and you have state laws and all those kind of things. But if they pollute in Illinois, it doesn't mean it's not going to get elsewhere. So those are the kind of things we are talking about when you think One Health. So when you talk about this, is an example of a flood event, and this is like a concentrated where they raise swine, and look at what happened when they had a rain and flooding system. So just to tell us how linked, and when you have all those wastes going to the waterways, what happens? You can see that you have fishes floating because they went to pollute the river massively. So it's very obvious that the environment, and then this is a protest sign by people that are pro-environment. And this was very, very instructive for me. You can Google it. On this side stood the town of Belacqua, New York. It was abandoned in 2012. That's just 10 years ago, after a routine hydrofracking operation left its soil toxic and its aquifer irreparable. So a whole city was abandoned in the US because of an environmental issue. So that is how linked the environment is to us. So now to the developing country, and of course I will use Nigeria as my example. We also have regulatory bodies. We have the Federal Environmental Protection Agency, State Environmental, FLD, and all those. But they have limited regulatory scope and structure and facility. Of course, they're supposed to do those things, but in practice, are they actually doing it? Like if I need to set up a factory, they are supposed to do environmental impact assessment and see what are the effluents I'm bringing, how is it going to impact the environment and all those things. I'm not sure these are things, most of these things are being paid lip service. So you have them, but are they really undergoing it, doing it? And I have other evidences from my PhD research and supervision that most of these agencies, just like importation now, they're supposed to cross-check and be sure that what we are getting is what we are getting, but do they really do these things? Not in practice, because most of these agencies don't even have laboratories to take samples and then go and cross-check. So it's not visible to everybody. In Nigeria, I've done a lot of study to look at what we have. And most of the time, we fail to understand that when we talk about food security, in most developing countries, we are focused on, okay, how do we get enough food for people? But we always forget that safety is part of, when you talk about food security, safety is also a component of food security. So this is a study I did on the abattoir. Look at the environment whereby people are getting meat. I'll just skim through that so that I don't waste a lot of time. The rivers, consequence of pollution and degradation of Nigerian aquatic environment on fisheries resources. So this is also a study. And then this one that I'll focus a bit on was from my PhD work. And this was derived in 2005 because at that time, leaded fuel was still sold in Nigeria. And I want to tell you that if the last country to stop selling lead in fuel, to put lead, you know, it sort of optimizes petroleum. So it's actually supposed to help. But what happens is that when you put lead in fuel, the lead, you know, sequesters and hence in the environment. And until July of this year, that was when the last country, Algeria, stopped putting lead in fuel. And like I keep saying, if you understand the concept of something being transboundary, once there's pollution anywhere, we are all at risk. And that's what we are talking about when you talk about One Health. So then leaded fuel was still being sold in Nigeria. And what I did was to look at the lead in surface water. And I found out it ranged between 0.5 to 0.90 milligram per liter. And then in fish muzzle, because we understand the issue of bioconstitution, between 0.05 to 0.07 milligram per kilogram. And surprisingly, well, but not really surprisingly, size, it shows that the highest level was in fish muzzle. And then the highest concentration that I found also was actually in pond water, aquaculture water. Why we understand that? Because most of the time the aquaculture water is like it's bounded, you know, unlike water which has the inlets and outlets and all that, whereby you can have dilution and all that. But in a pond system where you culture fish, so we find the highest level of lead concentration in pond water. And for that, I mean, to think you are going to eat the fish from those sources and all that, you can imagine how, you know, that impacts on human as well. The other study that was very instructive was, for me, was a master's work that we did in the Niger Delta. So many of the oil facility and operations are located within this sensitive habitat, which includes vital breeding, fish breeding, sea turtle nesting, mangroves and rainforests in the Niger Delta. And what we found was that they've been severely damaged. And the Niger Delta region of the Nigeria covers an area of over 70,000 kilometers square, and it's inhabited by over 7 million people. It's the Africa's largest and the world's third largest delta, and with diverse and sensitive ecosystem, including freshwater swamp. One of the things that we fail to realize is that most of our ecosystem is supposed to support life, and life is linked. So most of these people in these areas, they are artisanal fishery farmers. I mean, fisher folks. So all these things are not only linked to health, it's linked to livelihood. And so that's why when we're talking about the One Health concept, we're not only talking about health. One Health concept is just, like we say, it's like a strategy, a way of thinking. And in this Delta area, we found 16 priority aromatic hydrocarbons in 5 of the 6 rivers that we sampled, including the control sites. We detected in water, in sediments, in fish, and as you can see that some of these even fish that we got from the source had the glaze of pollution oil, and people are eating them. Actually, people are actually eating them because they don't have any other source of that's their livelihood, and that's what they eat. So in essence, what I'm trying to pass across is that pollution is a global crisis. If you go to India, you go to Australia, you go to Bangladesh, you go to China, you go to Namibia, you go to California, we have a problem with pollution. And it's something that we need to be aware of. So like I've alluded to, water pollution is an ignored global crisis. And now that we are talking about transboundary water, these pollutants do not stay on the Indian side or the Mexico side. I mean, if you pollute, what goes round comes round. If you pollute, it's eventually, I think before we used to have the, what do you call it, not in my backyard, as long as I can't say it, then it doesn't affect me. But now we know that so each year, some 30 million tons of raw waste are discharged in River Thames due to population pressure on the sewage system. And then Mexico City exports its untreated, in quotes, wastewater contaminated with pathogens and toxic chemicals to the Mesquite Valley to irrigate and increase crop yields. And so India Delhi discharges wastewater directly into the Yamuna River, the source of drinking water for some million people. So, so it's obvious that this, like I said, is an ignored public health crisis. So even in the countries where you have wastewater treatment systems, because ab initio we didn't plan for it, some emerging concerns are the price of pharmaceuticals and personal care products. People flush their drugs down the toilet. So this also have implications for non-point pollution for human, animal, wildlife, and the ecosystem health as well. So what are the implications for developed countries when you talk about it? Because like we're saying, we go from the known to the unknown. EPA estimates that 850 billion gallons of untreated discharges flow into water bodies annually, contributing to over 7 million illnesses. And aside transparent water, you also have, I just want to link them, transboundary movement of people, pets, and disease. And that is what was so obvious to us during the COVID-19 pandemic, because now to actually contain the disease, we had to lock down on movement. So diseases do not move by themselves. It's human, it's pets, it's water that carries pathogens and pollutants and all those kind of stuff. And so as we can see, so what are the effects of environmental health on animal and human health? I mean, let's just basically, studies, there are so many studies that show that the level of exposure to pollutants is often associated with chemical residues in animal and human system, especially if it's an animal that we're going to consume. And then you have subtle or subclinical effects in animals, including the oxidative stress, immunotoxicity, carcinogenicity, teratogenicity, and endocrine disruption. And so many of the diseases that we're seeing in recent times, at least the rate and speed of all those things, begs question about what has changed in the world or what is changing. Other adverse effects are increased infectious diseases, susceptibility, immunosuppression, reproductive impairment, and neoplasia. So we have like so many of immune response to all these things, and we have a lot of allergies and all those kind of immune-mediated diseases more frequently now. So when you think about it, for Nigeria, it's very funny. I mean, it's very alarming, the rate and speed of kidney diseases, liver diseases, and most organs that actually serve to detoxify the body. And we are having more of those crises now. And like I said, instead of just treating the symptoms, we need to go back and see what is actually making us to have most of these things. Why are these things becoming epidemic at this time? And that is what we need to look at. When you talk about environmental health, I brought this. This was something that they saw that avian botulism in Great Lakes, because of algae bloom, they were having avians that would go to drink the water were having botulism. This also, PFCs, perfluorinated compounds, were found in tree swallow. In tree swallow, what it happened was that it reduces their hatching success. Like the ecosystem supports our support system. So, and most of the time for us as veterinarians, one of the things we talk about is that animals are centuries because they are, most of the time they are smaller size and all those kind of things. So what we not quickly see happen in human, you can see it. They're like, they have as a sentinel to let us know that there's something wrong with our world. So when you have reduced hatching success, so you can actually extrapolate, maybe not directly, indirectly, that could be the effect on human as well, if they are exposed to the same compounds. So wildlife health, emergence of zoonosis has been linked to bushmeat marketing and consumption. Other factors associated with contact patterns include all susceptibility and pathogen privilege, including environmental variance. This time around, we'll be talking about what we call it climate change and all those kind of things, and other anthropogenic factors. These are bushmeat that have been marketed on the way to Lagos Ibadan, if you know Nigeria expressway, that have been marketed, that have been processed, and you can see the raw ones. So when you talk about bushmeat, like I would say, bushmeat, for people that don't understand, bushmeat is a Nigerian slang to talk about game. Animals, I mean, in English, people call it game, or wild animals that are being consumed, that are being hunted and consumed. So when you talk about the broader context, you look at the bushmeat issue in terms of the biodiversity. What impact does that have on conservation efforts? what does that have on economy? But for this purpose, we'll be restricting ourselves to the bushmeat issue and the global public health. So in the 2001 comprehensive review, 1,415 species were identified of pathogens, infectious pathogens for humans, and 175 pathogenic species were associated with emerging disease, of which 75% were zoonotic. I already said that. And for here, we just want to know that the vast majority of these are from wildlife. So transboundary movement of people. And studies have shown that human movement of pathogen by trade, by travel, is the most important of driver of disease emergence in wildlife. We want to do tourism, but are we doing the tourism responsibly? We want to get so close to the animal that we can pet a wild animal, leading to emergence of pandemic disease. Other things, like you can see, you know, how do you get close to an animal in nature that is able to grab you? So, but the fact remains that we cannot be selfish, because it's not only us, we are not only getting disease from wild animals, we are also taking disease to them. So it's not only affecting us as humans, it's also affecting animals as well. And when you think about actually the viral one, the mutation and the possibility of change when it gets to another host is something that is very, very scary for us. This is, I think, Nairobi. Wildlife park is very, very close to the city. So you can see at the background of that line, I don't know if you saw it very well, that you could see the line, skyline of the city. So the interaction of humans, animals, wildlife, and the environment has never been more important than now. You know, you see some practices, like I said, it's easy to laugh and still is their practice. But now, like I said, and that's why I'm bringing you pictures from all over the world. You cannot say that as long as human being will move around, it's not going to stay in the locality where it started. That's the truth. As long as we're going to move around for trade, for travel, for tourism, I can be in Nigeria today and tomorrow. And as I speak, by Sunday, I'll be in Rome because I'm going there for an event. So whatever I'm incubating, I'm carrying to Rome to visit them with it. So that is what we're talking about. The interaction is very, 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 very real now. And so we have to understand that geographical boundaries are only imaginary. We can no longer say, as I said, not in my backyard. This is the practice that they have in East Africa, whereby people bleed animal and drink the blood directly. So that is the last picture. So One Health, I think from now we need to think about why as an integrated way of doing research, of disease diagnosis, and of management in the balance of One Health as it relates to disease. So when you talk about One Health, it's essential for us to be able to have transformational breakthroughs. There are some diseases that you see in human that you won't even understand because it's not an animal, it's not a human disease. A doctor was not trained to recognize such a disease because it's an animal disease. And so until we start breaking barriers in research, in management of human, veterinary, and environmental health issues, we cannot adequately provide sustainable solutions. So this requires a paradigm shift in research conceptualization. How do you even imagine your research? How do you do disease surveillance? How do you prevent, diagnose, and manage and control diseases? Because we have all these boundaries within all the professions. Everybody is very territorial. I don't know what happens in other countries, but in Nigeria, people have a need for, oh, this one is more better, this one is more important than the other. There's no important profession. Until we collaborate, we are all serving humanity. And until we collaborate, then we cannot actually do our work effectively. And I think if you are going to take anything away from this lecture, that should be it. So I'm using an example. This work was a PhD work carried by Patricia Otu. She's also a colleague right now. And one of the things we tried to do was we found that bacterial ulcer disease is what you call an environmental disease. This was very, very instructive for us because it helped us to actually actively, effectively capture all the things I've been saying. It's the third most common mycobacteriosis after tuberculosis and leprosy. And it has a global geographical distribution in about 33 countries with increased incidence in West Africa sub-region. The epidemiology is still not clear, but has been associated with activities near water bodies in tropical and subtropical regions. And this is what the potential role, this where it's saying that it's an environmental disease because it's actually found in water bodies. And it's been found in wild animals as well. So it's not only human beings. So how does pollution affect Buruli ulcer? Buruli ulcer causes chronic devastating skin ulcers. And I'll be showing some pictures. If you are squeamish, maybe this is time to close your eyes, because I want to show some graphic pictures. So causes chronic devastating skin ulcers and often bone discoloration. So we carried out a preliminary study to determine the spatial pattern of the BU in susceptible communities in Ogun State, a state in Nigeria. And just an example of the kind of water bodies. And these are some of the lesions that you see. The ulcer will just not heal, and it actually disfigures the person. So a significant association was established between the river pollution and then we found M. ulcerans in environmental samples. Then the georeference map showing the case of the clusters and hotspots correlated with polluted waters were also produced. And then this was the first documentation of molecular characterization of M. ulcerans pollution with genetic relatedness in human. So we were able to isolate M. ulcerans from human, from water, and environment samples. So this is just, so the human activities, we show that human activities, that's the proposed pathway. We have people relating in water because we're able to also isolate from fish and crabs as well. So human activity, you go to the river to fish or to wash your clothes or whatever it is you do in those localities, and then you pick up Buruli ulcer, and also, infect the animals in the water. Overall, this research validated that a multidisciplinary approach is vital to solving health issues at the environment, animal, and human interface, hence promoting the one health, one world, and one medicine agenda. And also, some of the published work, we have some published work from this work to show that this work has been done. So it's in the public domain. So when you talk about the epidemiology and prevention and management of Buruli ulcer, it's obvious that this requires continued collaboration between physicians, veterinarians, public health experts, environmental health researchers, sociologists, because some of the things that we also discovered was that there was a stigma around it. Most of the time it's not even it's misdiagnosed, because most of the time people think it's an affliction, or it's your ancestors, or it's you've been charmed, or somebody did something to you. So by the time they are presenting at the hospital, is already advanced and all that, because there's a stigma. Most of the time they hide it and all those kind of stuff. So when you talk about collaboration, it's not only when you talk about health, whether environmental, human, or animal health, you even need to bring social scientists. You need to, like my PhD work, I did a lot of work with geography. So once you're talking about space and time, there are so many things that we need to do. So it's a unifying environmental ecological approach to the study of the disease and its prevention. And we still have ongoing study on Buruli ulcer. So in justifying why health, I think at this point I should have justified it if you think it's not necessary. But some of the most prominent issues putting pressure on global health today, which include the dramatic emergence and spread of zoonotic diseases, contamination of food, water, and soil, bioterrorist events, degradation of resources and habitats, climate change, all are issues that you can use, all require holistic, collaborative strategy to strengthen the collective capacity to meet these challenges. So we can continue to work in practical and practical solution is advocated. And it's, like I said, it's not only about diseases, it's not only about health, in every balance, in every domain. For example, the US Geological Survey Environmental Health Science Strategy addresses this relationship. When you have environmental drivers include natural health processes, accidental or intentional chemical or pathogen releases, land use change, resource extraction, global travel and trade, all these things I've mentioned, disasters. And then you have the environment, you have the environmental media. You breathe here, water, you get, you go to swimming pool with somebody, you go to the pool, you go to the river, the soil, sediment, the tissues. And then what are the exposure pathways? Inhalation, contact with people, contact with animals. And when you talk about animals alone, it's not even only wildlife. I think I will be remiss, it will be, I will be dropping the ball if I don't mention the fact that even now you have in most countries, people are keeping exotic pets. How do you control those kind of things? You have exotic pets. People keep pets that are not supposed to be in the house with humans. Some of the characteristics of keeping pets too. For me, I know people that are like more developed and advanced than myself might find it very, very, very funny. Because when my kids were younger, they said, oh, we want to bring the dog in. And I told them, well, English is not my in original language. And those people that gave us English talked about kennel. You keep dogs in kennels, not on my bed. So, but most of these things have changed with westernization, with advancement and all those kind of stuff. Because we know that if you get ticks from animals, you can have a disease that is also that could be debilitating, that could even kill you. So those are things that we don't take seriously. Oh, you think, it's because they are not taking care of their dogs. But people have been accidentally infected, tick fever and all that. So vector-borne disease, host-to-host transmission, and then you have contaminants, we have pathogen, you have interaction, and then you have a disease. And so the complex responses to all these things is what we refer to in One Health balance as environmental disease in wildlife, in domesticated animals, and in people. So and when you talk about One Health approach, it's been applied, bovine and human babesiosis report. So just to tell us that, it's improving food security through a One Health approach. That's another topic for another day. When you talk about AMR and all those kind of stuff, is a topic that we can talk about some other day. So there's a lot of application and applicability. The review of Institute of Medicine and National Research Council recommendation for One Health initiative. So, but like for this to work, I think one of the things that we need to talk about is the structure for it. We have to change our mindset, first and foremost, on individual basis. And also we have to intentionally, deliberately within the national context, regional context, we have some to actually deploy this in a practical way. But like I said, everything starts from the individual, changing of your mindset, changing how you see collaboration. This is an example. When you talk about interaction among these factors affect health and human and animal ecosystem. And whatever discipline you belong to, you find that you fit in here: environment and climate, human behavior and society, food and agriculture, economics and development. When you have interactions among these things, and I think one of the things that we didn't talk about, most of the other ones, especially if people that are on this webinar are in health or veterinary medicine environment balance, you will have an understanding. But when you talk about economics and development, so under this you have interconnected travel networks, unregulated tourism, you have globalization of markets, rapidly developing economies. Even some of these pets are illegally, exported, illegal wildlife trade, new road development into previously uninhabited areas, incursion into wildlife habitats, biotechnology, natural resource extraction, ecosystem governance. Like I said, the other time that a town was abandoned in New York, Belacqua, in 2012, it was natural resource extraction that led to what actually dismantled the whole town, a whole community. So inconsistent governance and infrastructure, all these interactions, whether it's human behavior, food preferences, increased susceptibility to disease, reduced physical activity, all these interactions affect health of human, animals, and ecosystem. And until we bring them together, we'll just be abstract. We'll just be treating the symptoms and not actually addressing most of these issues at the root cause. So internationally, OIE, FAO, and WHO have received the USAID funds to improve networking among human and animal laboratories. And we see a lot of that happening in recent time. And I was at UF in 2013, and UF announced a PhD in public health with One Health concentration. I think now we have an understanding that we need to break down barriers. And what this does is that we need to breed a new crop of professionals across all these disciplines, whereby we bring them together and expose them. We have effective program in Nigeria, whereby we have vets, medical doctors, laboratory scientists training together. But my own angst with this is that even within that training, they train them together, but they still maintain what you call tracking. So when I'm going to do my project or whatever it is, I still track, I still do the project along my professional discipline. I think we are still missing it as far as I'm concerned. It's about, breaking the barriers and breaking the boundaries, and ensuring that we can work across disciplines. I bring my expertise, you bring your expertise, and then we look at it from different angles, and then we're able to make fruitful, provide a solution. In particular, recommendations that were made from all these things is that the recommendations that point towards collaboration. We need to share resources more. We need to share data between all professions, coordinated research, and strengthen lines of communication deserve greater attention. And that is what we need to do more, especially on the ground. So for me, a One Health approach is integrated response. Most of the time when you are confronted with an issue, whether your research conceptualization, whether it's in practice as a medical doctor or a vet or environmental scientist, or well, in practice or in policy, is the mindset is what can I do? You know, or what can I do?
Tax policy includes the guidelines developed by a government regarding.
That is my Google. I'm not asking Google question, and Google is answering me. So what needs to be done is we need to change our mindset. What needs to be done? What are we supposed to do, as opposed to what can I do as a person? So when you talk about human health, animal, domestic, wildlife health, and environmental health, then what links us together is the One Health approach. And in conclusion, One Health is essential to identifying research needs and gaps, in knowledge, devising and refining management options. When you look at the One Health umbrella that I've given, that I put here, there's under that umbrella, you can almost find any discipline that you might think about there. Fostering long-term collaboration among practitioners and researchers in the related fields. And just to give us, to conclude, also, we need to integrate One Health mindset into our professional careers, develop international cross-sectoral professional networks. When you go anywhere, when we are somewhere, you find yourself anywhere, take time to listen to what people do, what other disciplines are doing. I've had collaboration across, so even legal, because like when you talk about environmental health, you talk about environmental justice. So, so you go there, you are trying to solve a problem, but you are confronted with some other issues of livelihood, which you might not have the expertise to handle, and which is also equally researchable. So ab initio, when you are conceptualizing research, factor in all those things. And number one, that will help you even to get a bigger grant, because now you are trying to solve a bigger problem that is bigger than what you alone can solve. When you need to do, we need to develop collaborative transdisciplinary research projects for grants and approach, so that when we are like doing something, we are not leaving something. Because one of the issues that we have even now is that when you are solving problem in balance or in domain, you are creating problem in another discipline, because you are just not integrating the solution. When you are trying to solve a problem, you are creating problem in another discipline. So we should also participate in ongoing interdisciplinary education opportunities. Care, if you see something that is like exciting and is related to what you're doing, even if it's not in your core discipline, listen, you'll be surprised at how much opportunity for collaboration exists. And more importantly, stay open to the importance of other disciplinary perspectives. Most of the time, like I said, actually in Nigeria, we have this need to, well, for my discipline is better than yours, or I'm more important than your discipline. And like I always tell people, we went into this disciplinary area not because I am a vet, not because I cannot be an environmental science, or I cannot be a sociologist or anything, but maybe that was just what my interest is in. And once everybody brings their expertise to the table, then we're able to do things well and prefer solution. I thank you for your attention. I hope I've not successfully put you all to sleep. And I'm be willing to take questions at this time. Over to you, Comstech people.
Thank you, Professor, for a wonderful presentation. So if there are any questions from the participants, we can have them in the chat. Okay, we have one. Yep.
Oh. I see one ask if yes, I was going to ask if you want to omit people and allow them to talk, because like when you said 1.5 hours, I was laughing because I talk really fast, so I know I was going to be through this before then. So of course there's a lot of opportunity for One Health concepts, depending on your discipline where you are at. I'm a core researcher, but one of the things that I found out is that it's like I said earlier, it's about the way you think. It's about your mindset. Most of the time we want to cage ourselves in our discipline, but there's a lot of opportunity for, I will take you outside of health so that you understand the mindset. the project I'm running right now, I'm doing on aquaculture biosecurity. And one of the things that is bothering the world right now, let me put it in a large context, is that we have a lot of research, right? But we are not translating those research to policy. And then people are not even getting to know what the usefulness of some of our research outcome. Most of the time we publish research and then it stays on the shelf. So what I did with my presentation, with my current project, is that when we're going to do dissemination workshop, most of the time when you as a researcher finish your work, you just say you publish and that's it, and then you get promoted and then that's all. But what we're doing right now is actually to carry people along with us. So we organize a what we call stakeholders meeting. Number one, even in research conceptualization. So we took care of the fact that how do you communicate your research beyond publication? That is a One Health approach. Because if I want to communicate my research effectively, I'm not trained to do it because I'm a core researcher. So I'll probably go to the radio and start speaking jargon, which the average man on the street does not understand. Like if I want to communicate the importance of eating polluted fish to human beings, to the populace, most of the time I just put all those things on lead and everything is published. But is it available to the populace who actually need the information? So what we did this time around differently was to bring in the media. So we brought in the media, we brought in stakeholders, we brought in farmers, we brought in people from the ministry government, and we brought them together to say, how do you see this problem? What is this problem like to you from your own perspective? And we got a fantastic feedback. I don't think I've ever done any research that has attracted. It's even a midterm thing. And we got a lot of it. If you go and put aquaculture biosecurity in Nigeria, you see a lot of traction on Google. Because not only did we do this workshop, we had a lot of online reporters that reported it. So the work actually traveled further than it would have done than just staying on the shelf. And so when you involve policymakers at this level, when we get to the issue of policy, it will be easy for them to get the buy-in. That is what we're talking about. So One Health is about how do you do stuff in a way that you are effective. So it makes the work more effective because now we brought in policymakers at this stage, we brought in media who are able to communicate with the public better. So that is just it. So in any discipline, there's always opportunity for you to apply the One Health concept. And then this question is that what is the main point of focus for the implementation of One Health? I think the main focus is to be aware that for us to actually be effective as the human race, number one, we can't be selfish. Most of the time, the human being will think about ourselves, how it affects us. But if you take care of the environment, ultimately we are taking care of ourselves. If you take care of wild animals and livestock, you are taking care of yourself. And I think that is what we need to understand more. If you talk about the issue of antimicrobial resistance, okay, there's most of the time before now, nobody cared about how animals, livestock are being raised. So people pump them with hormones, pump them with all this stuff, pump them with antibiotics. We keep forgetting that it's the same antibiotics that we use in animal that we use in human. And so now we have a lot of resistance issue, which not only affect animals, but also affect us. You have a problem, you have a bacterial infection, and they give you the antibiotics. It doesn't work because you've been exposed to those antibiotics through eating meat, eating fish. So I think the main idea for this, when you talk about One Health One Health concept as it pertains to health, is that as human beings, we have to understand, like I said, that the health of the environment, the health of animals is linked to our health. And I think when we have that mindset and understanding, we're able to take care of those parts that we neglect. Humans, we are naturally extractive. I want to build a house, I go somewhere, cut down trees, cut down stuff, and then build my house without looking at the impact of the environment, not even the environment, the ecosystem, because ecosystem is what supports us, our life. And I think that is one of the major things that we should take away with us.
Thank you, Professor. I think those are all the questions. If there are any more questions, I'll just take them over email and then just forward them to you to answer.
Okay, thank you so very much. I hope everybody has found this useful. And I think one of the things that we also discussed is that some of the questions were that they wanted the presentation,
yes,
sent, and I think I already forwarded to Comstech I already forwarded it to you this morning, and so he has it and is able to make it available.
So just to let the participants know, even this lecture is recorded and we will post it on the Comstech YouTube channel as well for others to visit later on. Also, the presentation, I have received it from you and I will share it with all the participants present here in the webinar today. So once again, thank you very much, Professor Allnight, for taking out the time and delivering such a brilliant lecture. We hope to have further lectures from you in the future as well. Thank you very much.
Thank you so very much. And if you could send me the link to your YouTube and all that, I can also.
I will do that. I will.
Yeah. Thank you so very much for having me. Yeah.